Hi everybody, I'm at Springs Aesthetics with Dr. Burroughs, and I was just complaining to him because I'm going to be 32 in May and I just feel like my face is losing volume, but I'm nervous to entrust my face with just anybody. But you have such an extensive background.
Sure. I get asked that quite a bit because injections can cause bruising, they can cause asymmetry problems, they can also be risky if they get into a blood vessel and cause, skin to have problems, discoloration, breakdown, or even blindness. So it's good to go to a qualified provider and injector. And my background is as an oculofacial plastic surgeon, so I operate around the eyes and on the face week in and week out, and I'm used to where the anatomy is, where the vessels are, where the nerves are, and we have techniques to do these very safely with even cannulas, which have a lower risk of getting actually into a blood vessel. So you bring up a good point, and all I do is concentrate around the eyes and the face. So what kinds of concerns do you have as far as, what you're seeing now?
I'm just noticing a lot of volume loss. Like my face is starting to look a little bit more tired than it used to.
Okay, so if you want to look with the mirror, I can show you what we can do. So what I see a lot as we age is that parts of the fat pads in the face start to deflate and then also sag down. And as that occurs, it can cause the hollows and the dark circles that we get under our eyes. It can cause prominence to the parentheses or nasolabial folds here. People can get the marionette lines start to develop, jowling here, and then you can also just get areas that are starting to sink in because of that fat atrophy. Furthermore, the brows can descend because of the brow fat pad loses some of its volume, which helps it normally stay up a little bit. And so if you can address those areas of volume deficiency that we see with age by putting filler back in, you can help all of those areas. And so what I'm hearing from you, Maria, is that you'd like to get the circles under your eyes better and smoother, and that can help with that. We will support your mid-face here with some filler, and that'll help reduce the nasolabial fold and give you a nice pretty projection right here. And everybody knows nice cheekbones are a beautiful feature to have. And then another issue that ladies can run into that bothers them is that their lips start to atrophy after about the age of 30. And so we have great fillers that can help accentuate the lip and give that nice plump appearance that you had when you're just a bit younger. So
I think we should go for it.
Okay, let's do it.
So we just finished up. Dr. Burroughs, can you kind of take everybody through what you did again?
Sure. So we started out with enhancing her cheekbone area, and then that's the filler that will help lift the cheeks, give you nice pretty cheekbone structure. It also helps lift the tissues that have been sagging down. It supports the eyelid cheek complex better as well, which makes it smoother, which is a nice, youthful, beautiful look. It also can help with the deep parenthesis lines, the nasolabial folds, and the marionette lines. We then followed that up with putting in the filler underneath your eyes, the Bellatero, and that lasts about 1 year to 2 years, and it helps smooth the contours between your cheek and where it blends with the eyelid. Gets rid of the hollows and it helps with the darkness. And then we finished things up with your lips and put in Restylane there, and we worked hard to improve the symmetry. So we put more in your left upper and your left lower, and I think they're balanced a lot nicer now. And we kept that important proportion so it looks natural by keeping your upper lip only about 35 to 40% of the size of the lower. And then we put a small amount into the brows there just to enhance that area. It's a very beautiful feature to have, and it can help give that nice, beautiful arch that you have already, but it accentuated it. So the cheekbone radius lasts between 1 year to 2 years, underneath the eyes 1 year to 2 years, and then the lips about 9 months. So now one thing that can help it last longer, and you get this with the injections, is the SkinCeuticals hyaluronic acid intensifier, and it boosts the levels by about 30%, and 2 of the 3 fillers we used are hyaluronic acid, so that's important to use twice a day going forward.
Well, thank you.
Yep, you look beautiful. Here you can see the before and after lips, the before and after lower eyelids, and then her full face showing the improvement of the eyelids, cheeks, and lips.
Yeah.
Girl, you look good.
Thank you. I was super worried that I was gonna look like overdone because
Right.
he did do like a lot of like little bits, but I get so swollen after when like something happens. I get like you know, like when people get mosquito bites and it's just like a little reaction.
Right.
Mine like swells up to a giant welt. So yeah, so like that's what I was worried that was gonna happen, and I was a little swollen afterwards, but it's totally normal.
Yeah, so did it hurt when they were injecting you?
It did a little bit, but they are so kind. They put like a topical thing on, and then they had injected a little bit of like, you know, what is that, like lidocaine or something, just to like numb certain areas. But I would say like the lips did hurt a little bit. The rest of it was just weird because you could kind of feel like something was there,
like,
but it wasn't like I'm gonna cry.
Right.
Yeah.
And is it super expensive to get done?
Well, it depends. So Dr. Burroughs is so wonderful. He works with everybody. You go in for a consultation, you kind of tell him, you know, what you don't like, and then he talks you through, you know, what he would suggest you use. And then beyond that, there are different types of filler. You know, there's kind of like a scale. You know, you can go with the really expensive one, and then that'll last you for longer. Or you could go with the cheaper one and then see, you know, if you like it, because usually the cheaper ones don't last as long, and then you're not stuck with something, you know, permanent. Well, I mean, it's not. That's not permanent.
Yeah, and so it lasts about how long?
Well, the stuff that he put in under the eyes, I think he said would last, and like by the cheeks, would be about 1 to 2 years, depending on how well, because your body will absorb it at different rates.
Right.
So if your body metabolizes things faster, that wears away faster. But I mean, it lasts longer than like Botox. Botox is only like 3 to 6 months, depending on which one. So filler is definitely going to last longer. And if you don't like it, he can go in and adjust. Like there's something you can do. Yeah, it was something to like dissolve it.
Okay.
So he could do that, like go in and dissolve it.
Right.
So it's a great alternative to like permanent things. You know, if someone's worried, you know, you want to get a facelift, but like that's a really intense surgery.
Yeah.
But you just want like a little lift. Filler's great. And Dr. Burroughs was so kind because I'm such a big baby.
Me too. I was watching you do that. I was like, there's no way that I could get that done.
You don't see it. You don't see the needles going in, so it's not as freaky. Like I couldn't watch the video, but yeah.
Well, great. Well, you look great.
Thank you.
And he did a good job. So.
Yeah, I mean, I don't feel like I look overdone.
No.
You be honest and tell me.
Yeah, I know. You look great.